If you just happen to be in Nogales, Arizona, at the St. Andrew's Episcopal Church on the first Thursday of each month, except July, you would see one of the most amazing transformations of a church building into a medical clinic that you could imagine. All other times of the month, the church is filled with normal parish activities. But on this day, the sanctuary becomes a vision clinic. Sunday school rooms are filled with orthopedic patients. The sacristy room is transitioned into an audiology fitting area. The foyer is full of physical therapy patients, and the pastor's office is used to draw blood for testing. It all began some 35 years ago when Coco Romero, a young mother living south of the border, couldn't find help for her young son who was suffering from cerebral palsy. She, along with 7 other mothers and their children, began meeting with a speech therapist from Tucson, looking for ways they could help their children. The therapist, however, saw another need, the need for orthopedic help. She knew a young doctor named Mark Franco, and he became the first physician of St. Andrew's Clinic.
He came down and he started seeing those kids, and he says, well, I think we can do something for him if someone takes him over to Tucson. So that's the way it started. So then he knew he needed to bring the orthotics because they needed braces, physical therapy, and it went on and on. All of a sudden, we didn't realize how fast we were going. So at that time, we had to come into the United States because doctors were crossing to Mexico and they didn't have a license to work there. Even though there was no surgeries, they were concerned. So St. Andrews opened the door for us. So ever since then, 38 or 39 years ago, we've been here. And out of 7 kids, our number today registered is 300 kids.
It's 8:30 in the morning. This day, over 300 children with their parents are lined up outside, waiting their turn. Just like parents everywhere, they want the best for their children. Some parents travel 2 or 3 days just to be seen here by the volunteer medical professionals who donate their time.
They are the poorest of the poor, and they sell whatever belonging they might have to buy that bus ticket to get to the border. But as soon as they get across that border, they don't pay for anything.
These parents travel 20 hours to have their son seen by this doctor, now one of the leading orthopedic surgeons in Tucson, who incidentally started here at St. Andrews when he was a teenager as an interpreter for Dr. Franco. Dr. James, a hand surgeon at the Shriners Hospital in Sacramento, along with one of her colleagues, comes here once a month to examine and determine who needs referrals to their hospital. The clinic provides practically every specialty for these children, and in addition, every 3 months, specialists in cardiology, dermatology, and psychology offer their services. Malnutrition is one of the great problems St. Andrews faces with these children. Each child diagnosed as such is given time with a nutritionist who goes over a regimen for feeding with their parents, along with nutritional supplies to aid in their healing. St. Andrews is completely dependent on donor gifts, grants, and fundraising events led by the executive director, Laura Romero. Regrettably, there are those who are concerned about the political implications of allowing people to freely cross our borders. Laura answers it in this manner.
At the end of the day, you must understand, children have no borders.
The Arizona Interfaith Movement salutes the St. Andrew's Clinic for their outstanding ministry to the poor children across our border and is proud to present to them the 2012 Humanitarian Golden Rule Award.